Hi, of course, come on in and just take a seat there for me. So there is a switch on the side of the chair if you want to adjust it. I know you do look quite tall. I think you may just need to raise it a little bit. Yeah, perfect. Have you found it? Yeah, beautiful. Okay, so first and foremost, before I introduce myself and before we get started here today, I am just going to have you confirm your name and your date of birth for me. I, of course, just want to make sure that I have the right patient in front of me today. Perfect. Now, are you spelling that with an E or a Y? With an E, okay, because it is on your record as a Y, and I did think beforehand when I was looking, I thought that might be a spelling mistake there. So let's go ahead and edit that for you. Perfect, okay. All right, so that's changed there. Okay, so my name is Isla, and I am one of the therapists here. We do have several therapists here specializing in a number of fields, and we're all matched specifically to our patients based on our background, our knowledge, and our area of expertise, okay? So I typically work with patients who are experiencing panic disorder, generalized anxiety disorder, and also post-traumatic stress disorder. I want to let you know, first and foremost, that there's no timelines, there's no deadlines, and there's no requirement for you to complete a certain set of sessions, okay? I am here as your therapist for as long as you need me. All of our sessions are covered in their entirety by your health plan, so as I said, I'm here for however long you need me, and really however long I'm able to provide benefit for you in your journey, okay? I know some of my patients are a little bit worried and a little bit apprehensive about maybe the number of sessions that they will require, but as I said, there is no set number, and I'm here for however long you should need me for. All right. Now, I will be using a range of therapeutic techniques throughout our sessions, and of course, I will explain those as and when they're used, but my general approach is very gentle. I want you to see me and this little room we're in as being a place where we can safely explore your emotions and where we can process your thoughts. While I do try and make my therapy sessions as comfortable as possible, of course, I do acknowledge that exploring the areas that we're likely to explore, this may evoke a range of emotions for you, and I know that some of those may be quite uncomfortable for you to feel, but I want to kind of assure you that I will always be here to guide you through them. So even though you may feel uncomfortable, I'll always be here and we can kind of get through this together, okay? All right. Now, are there any questions you have at this point about therapy in general or about your specific journey? No? Okay, that's absolutely fine. If you do have any questions along the way, I want you to feel comfortable in just asking me, okay? You don't need to worry, there's no judgment here, and we can just have an open discourse about any of your concerns, okay? So what I'm going to do first of all is just log on to our online portal. Did you receive your login details for the online portal? You did. Perfect. Okay. All right, so let me just bring this up. Just to make you aware as well, I will be taking a mixture of written and electronic notes throughout our sessions. The written notes are just for me to kind of help me formulate future sessions for you, and then I will be uploading directly onto the portal as well, which you can access. And of course, when I do that, I will be using the laptop for that. Okay. All right. So I do have your record up here, and I can see that you have recently been started on a medication by your general practitioner. Okay, so I wanted to just start with that and kind of just touch base with that. So how are you finding that medication? How are you feeling on that? Okay. Yeah. You're absolutely correct. There often is, with that particular class of medication, there often is a period of adjustment. Some of my patients actually report that their symptoms do increase in severity initially, but it will ease over the next 3 to 4 weeks as your body adjusts to that increase in serotonin. So what I would do is actually encourage you to write some notes down about how you're feeling. So I know, of course, you just mentioned the headaches and the nausea. So what I would say is write some notes down, and then when you have your review with your general practitioner with regards to your medication, you can actually show them that, and they can maybe kind of adjust your dosage or even explore other options for you. Okay, I can see that I think you have your review appointment. It looks like you have that in 2 weeks' time. Yeah, okay. It's important to note that there are so many different types of medications, and sometimes it can be a little bit of a process of trial and error to really find the appropriate treatment plan for you. But I want you to be assured that there are so many other medications available, and there's lots of different options. So if that isn't working for you, your general practitioner can pop you on something else, okay? All right. So let me just make sure we've got that. And just to double check, it's the 15 milligrams, is that correct? Yeah, okay. All right. It is worth mentioning as well, and I do tell this to all of my patients, that pharmacological interventions and therapy-based practice do have a synergistic relationship. So one is not necessarily more effective than the other, but rather they kind of complement each other. So I know for some of my patients, they can be quite hesitant to embark on their medication journey, but as I said, therapy really works well alongside of it, and I don't want you to kind of think that throughout any of our sessions we are demonizing the pharmacological route. Okay, as I said, they work really well in unison. All right. So throughout this first session, what I will be doing is just asking you a few questions, just getting to know you a little bit better, nothing too in depth. I won't be drawing from any specific therapeutic theory today. It's just an introduction session, as I said, where I can just kind of find out a little bit more about you and a little bit more about your journey. Okay? All right. So just to begin with, and when you feel ready, just tell me a little bit more about what has brought you in today. No, you're explaining it perfectly, don't worry. And how long have you been feeling like that for? Is it something new? Is it something you've been experiencing for quite a while? Okay. No, so that is something that is very common, and it's something I do hear quite a lot in my sessions. I think a lot of people, they almost become accustomed to living with such a high level of anxiety that when a specific event such as the one you mentioned happens, it can almost trigger it into a panic disorder. So it can start where you just sort of have generalized anxiety, and people may kind of manage that relatively well, but then some sort of event will take place and that kind of tips it a little bit more into panic. So no, that's completely normal. Exactly. Yeah. All right. All right, so just for a moment, and again, if you feel comfortable doing this, I want to really explore how this is manifesting specifically for you. So you said you're finding yourself having regular panic attacks, okay? Now, what is the panic attack looking like for you? How is it presenting? All right. Okay. Yeah, so sort of a sudden feeling of not being present or not a yeah, so feeling as though you're observing a situation rather than actively participating in it. Would that be a fair assessment? Yeah, okay. No, it's absolutely fine. So, this is your experience, and it's your body that is experiencing it at that specific time. So, you're explaining it perfectly. Don't worry. Okay. And just to go back to what you said about the tingling sensation, okay? When you're getting the tingling, whereabouts are you getting it? Is it in your arms, your legs? Okay. And do you find that anything specifically triggers one of these attacks? So, a specific person, an environment, a task that you complete? Okay. No, so that is completely normal. So, a hallmark feature actually of panic disorder is that the attacks tend to occur with very little warning, and there's often no specific trigger. They do just kind of come on out of the blue, like you mentioned, though. So, that's absolutely normal with panic disorder. Okay. And when you're having one of these episodes, do you find that anything sort of helps to ease it? Have you tried anything that you feel like really helps to kind of take you through to the other side of one of those attacks? Okay. All right. And have you ever received any treatment before for these attacks? So, whether that be medication or therapy? Yeah. Okay. No, again, it's something I hear so often in these sessions, and it's really because panic disorder manifests in such acute physical symptoms, such as the increased heart rate, like you mentioned, the trembling, the palpitations, the tingling sensation. It's really not uncommon for patients to be investigated for a number of physical conditions before they actually receive their diagnosis of panic disorder. So I find some patients may have actually been experiencing panic disorder like yourself for several years or even decades before they actually are referred and receive appropriate treatment. So no, you're completely not alone there. There's so many people who have experienced a similar situation. It is absolutely. It's not uncommon at all. Okay. So now I'm going to move on to some general questions about your life, your work, and your family. Now, I know you did say that whilst your work is no longer a trigger for you, you did experience your first panic attack at work. So, what I'd like to do first of all, and again, if you're comfortable, I would like to just explore a little bit more about your working situation, if that's okay. All right. And as I said, I am going to do a mixture of notes. Okay, so I'm just going to write something on the portal now. All right. Okay. So, how long have you been in your current role? Okay. And what shift patterns are you working now? Okay. So, you're in primary care now. Okay. And how have your symptoms changed since you've transitioned into primary care? I know you said before that your new job has enabled you to kind of feel a little bit better. So how have you found your symptoms since you've started in this job? Yeah, they've changed quite a lot. Okay, how have they changed? Kind of what have you noticed about them? Okay. And I know you mentioned that your sleep was very disrupted when you were working those night shifts, okay? How is your sleep now that you're working a standard day pattern? How is it doing now? Okay. All right. Okay. All right. I also want to just briefly touch on what you just mentioned about your symptoms changing in your new job. You mentioned feeling as though you're able to kind of enforce boundaries a little bit better now in this job than you were in your previous job. Could you kind of just tell me a little bit more about that? What boundaries they may have been? How are you enforcing those boundaries now? Okay. All right. Now, as I mentioned before, it's your experience and you are explaining it just perfectly, okay? Don't worry about how you're phrasing things. Okay. So, would it be a fair assessment to say that the reduction in panic attacks have correlated with you enforcing those boundaries? Yeah, okay. And that is something that we are definitely going to pick up on in our subsequent sessions, okay? Because setting our own personal physical and emotional boundaries, they really allow us to protect our own space and ultimately prioritize our own well-being. And really, when we affirm our boundaries, particularly when they're being tested, it really validates our own sense of self-respect. Now, the boundaries that you touched on regarding your work and your interpersonal relationships at work are, of course, important, but we also have intrapersonal boundaries as well, and they can be strengthened over time. So, how are we sort of treating ourselves? What boundaries do we have in place for ourselves? Okay, but as I said, we can talk about that more in subsequent sessions, okay, and we'll kind of explore that a little bit more together, okay? All right. I do find that a lot of my patients with panic disorder do tend to have a little bit of difficulty in kind of enforcing their own boundaries. So I do really find it as something of benefit to kind of further explore. Okay. All right. So now I do have some questions about your family. As with before, there's no right or wrong. I'm not trying to psychoanalyze the dynamics of your family. I'm just seeking to kind of understand a little bit more about how your family functions day to day and kind of what your role is within your family. Okay, so first of all, growing up, did you have two parental figures in your households? You did. Okay. And were both figures present throughout the duration of your time at home? Okay. And how would you describe your relationship with your parental figures when you were younger? Okay. Did you have any siblings in the house? Okay. And what is the age gap with your siblings? Okay. She did have them very close together, didn't she? Especially yourself and your brother. Okay. So generally, how would you describe your relationship with your siblings when you were younger? Okay. Okay. And how did you feel in your family growing up? How did you feel kind of within yourself? Okay. Yeah, that's perfectly normal. That's something I hear very often. That doesn't mean it was dysfunctional, but yeah, it is something we hear quite a lot here. So no, it's absolutely common to feel like that. That's okay. As I said before, this is a no judgment area, so you can share things even if you feel like maybe you say something and it maybe sounds a little bit different than what you were intending. It's absolutely fine then to kind of explain it further, so don't worry so much about trying to phrase things in a certain way, okay? I absolutely don't mind. I just want this to kind of be a bit of a free flow exercise, okay? All right. So I think some of your answer to that question will also tie in with this question. So, what do you feel your role was in your family growing up? And again, just kind of free flow. Don't think too much about the answers, okay? Okay. All right. Okay, that's perfect. So, what I want to know now is how did your family as a whole sort of handle heightened emotions? So, how did you, as a collective unit, handle emotions such as anger or sadness? Okay. All right, that's absolutely fine. Yeah. Okay. Again, I think some of your answer may tie in with this next question, but when you were younger, who or what were you seeking out when you were feeling heightened emotions such as sadness or anger? Okay. It is, and I encourage you again, if you want to just take some time and you want to kind of just step back, that's absolutely fine. I know that sometimes when we're reliving these experiences in our head, as we have to sort of do with these questions, they can bring up a lot of emotions that maybe we haven't felt in quite a while. So if you want to just take a moment, that's absolutely fine, okay? No, you're okay to kind of continue. All right. Okay. So, how did that parent respond when you were seeking them out and you were sad or you were angry? Okay. hmm Okay. Okay. Did you feel there were any expectations placed on you as a child within your family unit? I know you just briefly touched on feeling as though they weren't really supporting you and feeling as though you had to kind of self soothe a little bit. So, do you think that was an expectation placed on you? Do you think it was something that you felt as though you had to self soothe because you were supposed to be strong, or you were supposed to be the kind of the older sibling and you were supposed to be kind of looking out for everyone else? Okay. 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 That's absolutely fine. Would you like to just take a moment? No, you're sure? Okay. We will just park that discussion. Just for now, I can see that it's bringing up a lot of emotions for you. And again, it's really good to be able to explore those emotions. But what I would like to do in this introductory session is not make it too emotionally taxing for you, okay? But I do appreciate that you were going into areas which maybe you haven't discussed or even you haven't thought about in quite a while. So just to kind of reiterate, it's completely normal to feel those emotions and to feel uncomfortable, okay? But I want to just affirm to you that those are perfectly normal and perfectly healthy reactions when we start to kind of dig into our childhood a little bit better, okay? All right. And we will further discuss that, of course, throughout subsequent sessions as well, because really how our roles and expectations were when we were a child, they really do affect the way that our nervous system works into adulthood. So it really kind of forms this cornerstone for how we respond to threat and how we respond to perceived harm as well. So, as I said, I appreciate it as a very uncomfortable topic, and we will kind of broach that going forward, but as I said, we'll do it in a very gentle way. Okay, all right. Okay, so what I want to do to close our session today is just a little bit of an exercise from one of my books. What I want to try and get you thinking throughout our sessions, and of course in everyday life, is to really try and tune into your emotions. So a lot of the time with panic disorder, we don't really want to feel those physical and psychological symptoms, and it's a completely rational response to want to kind of block them out and try and eradicate them and kind of shut them off. But as we'll explore in future sessions, by actively fighting those physiological and psychological symptoms, they actually begin to gain more strength. Patients with panic disorder can sometimes also have a really maladaptive coping strategy of sort of numbing or blocking not just the emotions that are associated as being bad, so the panic symptoms, the anxiety symptoms, but they can also find that they're less responsive to situations or events that actually once made them feel joyful or happy. So they're less perceptive to those good emotions as well. So that kind of strategy of trying to become numb or trying to block can actually close ourselves off from those good emotions that we once felt as well. So what I want to do with this particular exercise in the book is I want to look at all the different emotions that we feel, and I want you to kind of identify ways of recognizing them. So knowing when they are in full force, even if they feel uncomfortable or even if they feel good, I want you to really be recognizing what's happening and how they're manifesting in your body, both physically and psychologically as well. Okay, so as I said, acknowledging them, we're not trying to delete them or block them or kind of shut ourselves away from them. Okay, so I am just going to get this activity up. So what I want you to do, and we can start with any of the emotions, I want you to explore how they feel to experience. Again, let's try and do this as a bit of a free flow exercise, so don't think too much about your answers. Once we've identified how they feel, what I want us to do under each of them is write an act or a skill that we can actually put into place when we start to feel like this. And again, we're not ignoring, we're not blocking, we're acknowledging, and we're acting on it, okay? So we're acknowledging that we're feeling a certain way, but we're adapting to it and we're putting something in place. So it's not as though we're employing a skill or a hobby or something to kind of shut ourselves out or distract ourselves, but we're thinking, what can we employ to actually help us further recognize that particular emotion? Okay, so I will let you look over those, and we can start with whichever one you would like to. I can give you a little bit of an example if that would help. I know some patients can sometimes struggle to kind of make a start, but once they do start, they do find that they can kind of get through these really well, and they really tap into that part of their brain that just kind of lets them flow through this. So again, if you want me to give you an example, I absolutely can. Yeah, perfect. Okay, so let's see. So we could look, let's not focus at the moment on panic or anxiety symptoms, okay? So let's look at, maybe we could look at this one. So, jealousy. So we could say that when we're jealous, what type of kind of physical symptoms are we feeling first of all? And if you want to write them down on there, and I will write them down here. Okay, so we both kind of have a little bit of a record there. So think about jealousy for a moment. Think about maybe, I don't know, when you last experienced a really visceral feeling of jealousy. How did it physically feel? How did it manifest? Yeah, perfect. That's a really good way of explaining it. Okay. Okay. Yeah, absolutely. And how did that kind of manifest though? So that's not so much a physical symptom, but it's really good. But how did it physically manifest? So we started off where you were discussing kind of feeling this gut feeling and almost like a sick feeling, okay? But then you went a little bit more into the psychological side of it. So just for now, let's just start at how would we know to recognize it physically? Perfect, okay. Yeah. Okay. Yeah. All right. And now let's go back, and you were starting to describe how that psychologically feels. Okay. Yeah. Yeah. Okay. No, you did that really well. Don't worry. So, when we're thinking about feeling all of those physical symptoms, the psychological symptoms, what could we do in that moment? How could we employ some form of coping strategy? Again, we're not trying to block this, so I don't want you to kind of be thinking of how can we distract ourselves, but how can we almost lean into those symptoms? Okay? Perfect. No, that's absolutely wonderful. You are really leaning into that. That's good. Okay. Yeah. Okay. Yeah. So the last segment of what you said in particular was really, really valuable, and I would encourage you to write that down. So you talked about not waiting for it to pass, and that is something which again is going to be the cornerstone of what we're going to discuss in future sessions. So you're not waiting for it to pass, you're feeling it, and you're kind of, I think you phrased it beautifully when you said, I'm just going to sit in it. Yeah. Okay. Yeah,